Right, folks. Dr. K here with another hot take. I was taking heat earlier in the pandemic when it came to this idea of commenting on the impacts of lockdowns in our economy, saying how if we shut down things further for extended period of time, a lot of people will suffer economically, and as a result, health outcomes are going to suffer. Because to me, economy equals health, straight up. I got so much flack about saying, "Hey, do you not care about people's lives? How can we prioritize money when it comes to health?" And frankly, I was pissed then, and I'm pissed now. Okay, you look at our current state of affairs. Talk to a 28-year-old about buying a house right now. Look at the data that when we look at how much people are spending on groceries. Definitely the cost of groceries have gone up for sure. But do you think people are spending more of their income on going to the grocery store? In fact, it's gone down. And so you ask yourself, what are people eating? Whether it's fast food, whether it's highly processed food that will carry more likely to have a health risk and carry its own risk of chronic disease such as type 2 diabetes and obesity. This is where we're going. There's more data to support metabolic health and mental health. So a more obese population, a more metabolically unhealthy population that's eating more crap is more likely to become, in my opinion, mentally harmed. This is where we're at. People barely making ends meet, so they're not going to a gym. They're not focusing on exercising. They're focused on survival. So for those that were chirping, saying, who cares about the economy? Look at my face right now and tell me this, that we shouldn't be caring about our economy. Economy is health. You look at the people that I was seeing, whether it's in the pandemic or in the ICU, the people living on the margins. It's not people that are thriving. And you look, like I said, you look at the people's circumstances. You want to pay for high quality food. You want to be able to take time for yourself to restore yourself. You want to be able to be part of an exercise program or community. All these things are impacted by the economy, and these directly impact health outcomes. So all this to say is, amongst many things that we talk about during the pandemic, this has got to be one of them. You cannot sacrifice the economy. You can't just approach things not holistically. You've heard me say this many times. As an ICU doc, if you're not looking at things at a high level, if you're not looking at the whole patient, if you're not having a holistic approach, the patient will suffer. You need to think about what this medication is going to impact that we're focusing on your heart. What's it going to do to your lungs? What's it going to do to your kidneys? What's it going to do to your gut? Those are the processes that we're going through. So when we have policies, health policies in the future, you need to think of that first order, second order, third order approach. That, okay, yeah, we'll shut down the economy, but what's that going to do to people that are on the margins already? How are they going to afford high quality care? How are they going to get how are we going to meet their needs over the upcoming years? And I'll tell you this much, I don't hear a plan. And I'm kind of getting sick of this idea that we're just being so passive about this. I want our leaders right now to have some urgency, to have some bite, to have some juice, to have some fire behind their backside. Because it's like, what are we waiting for? We have this whole generation that is looking at things like, if you're, like I said, I don't know, I get my generations mixed up, Z, W, whatever it is. They can't afford a home. You're up against it like this, and I just think we got to do better. What's the approach? how we approaching health. And we need to, the other part of this too, and not to get too deviate from messages, we need to put some money in and resources into prevention. If we're going to approach things this way, where we are quote unquote not supporting the economy the way we can be, like, we need to think about how we're going to prevent people from using sick care system. And we're adamant on this platform. We talk about how to eat, what to eat, how to exercise in practical ways, how to reduce your stress, how to connect with others. But these messages need to be amplified. They absolutely need to be amplified. And I mean, I'm sorry this has come across a little bit testy, but this is the way it is. This is the way it is. I want us to learn not to do this again. And part of the reason I'm testy about it too is because I'm not hearing any accountability. Zero accountability, in fact. You come across hard saying all these things about not thinking about the impacts of our actions, and then not recognizing it down the road. I'm sorry, that's not the way we lead. That's not a way to lead. Be accountable for your actions and then come up with a plan. That's what I respect. Come up with a way that we're going to pivot. What is the plan moving forward? And start changing the boogie, yo. That's all I got to say. Everyone stay fresh and dynamic. Peace.